Yeah. Good evening, everyone. Today we'll be discussing about the basics of hand splintings. I'll be talking basically certain theories and principles behind hand splinting. Okay, so in this chapter today we will be discussing about various principles, theories, and what are the factors that you should consider while designing and fitting the splints. Okay. Also, what all factors you should consider to go about what type of splint to choose. Okay. The first thing that you should be aware is the phases of wound healing. As you all might know, that the phase of wound healing occurs in majorly in 4 stages. One is bleeding phase, inflammatory phase, proliferative phase, and remodeling phase. Most of you might be knowing what these phases are and what happens physiologically and pathologically. Okay, so basically, anyway, I will explain. So in the bleeding phase, blood comes and blood clot happens. In inflammatory phase, the fibroblast cells comes and the necrotizing process and inflammatory process occurs, basically destroys the debris and microbes. Then followed by the proliferative phase where the cell migration happens. Then in remodeling phase, maturation of the wound occurs or maturation of the healing occurs. Okay, so followed by you should be aware of the anatomy and some of the physiological properties of the musculoskeletal system. As you all may know, this fascia is muscle fibers, muscles, tendons, there's a fascicles, myofibrils, muscle fibers. So you should be knowing the property of each thing. Basically, the whatever the type that you should be choosing, you should be knowing what structure you are planning to stretch, or you are planning to immobilize, or you're planning to facilitate. Whatever the purpose, you should be knowing the basic anatomy behind it. Also, you should be knowing the articular structures, joint structures like articular cartilage, joint cavity, capsule, ligaments, and then synovial membranes. These factors will help you that what are the joint structure which is available. So putting extra effort on these joint structures, it will damage. So you should be knowing the right amount of force the joint structures can tolerate. So based on it, your type of splints will be decided. Okay. Fine. As soon as you understand the basic anatomies, you can move on to the type of splints. Majorly, based on the purpose of application, the splints are divided into protective, preventive splints, corrective splints, and there are other types which I'll be explaining in the upcoming slides. Okay. What all protective splints? So basically, these splints are used for immobilizing the damaged structure and to promote tissue healing. So these type of splints are used for immobilization purpose to promote tissue healing, like whatever, for example, the casts that you do, or basically a protective splint which will promote the healing. Also, we design protective splints which will be given in the phase of inflammatory and proliferative phases. Okay, fine. So these splints will help you to promote healing. Because there are different types of splints. So this is a cock up which is used to immobilize the wrist joint. Okay, there is a preventive splints. These splints are used to prevent contractures. Okay, so these type of splints are used when the wound healing or tissue healing reaches the proliferative phase or the initial stage of healings. Okay, so as soon as the inflammatory phase ends and in the mid of proliferative phase, most of the surgeons go for the splints. Okay, so the picture that you see is a short-term spica. It is used for preventing web space contractures. Okay, so there is a major thing, corrective splints, which only therapists like us can only make. So these type of splints are used once a stage the at the end of the proliferative phase or during the remolding phase. Okay, so this is used to um, tense the structures, to elongate the structure. These type of splints are used. So when the contracture originates, basically in the rehabilitation phase, this type of splints are really useful in the ortho and neuro point of view. Okay, so this type of splints are used to correct the soft tissue contracture. So as you might be knowing, sir has explained what is meant by contractures and deformity in the previous slides, previous days. So these always our splints are designed to structure soft tissue structures and not of osseous structures. Okay, fine. So as I told before, there are other type of splint, which is something interesting. We can use splint for therapy and splint as therapy. So what I mean to say is, splint for therapy means splint can assist us to provide the therapy. Also, splint as a therapy means splint act like a device for the therapy. So we'll see some videos that I have taken in my hospital, so which will guide you what I mean to say. Yeah, so this is splint for therapy. Okay, so you can see the patient was given with elbow gutter under resting hand splint, and then he was performing an activity. Okay, so instead of me holding in the RIP pattern, so these splints help me to do that, and I can able to break the toes. Also, so see this also there's an interesting factor that I would like to share about this patient. So this patient is a 5-year-old stroke. He came to me so just for my ability to think beyond what is in the book. So he got attracted by this my way of therapy using splints for the intervention. So if you also practice in your practice, so it will also differentiate you for being different from other therapists. Okay, so splint as a therapy. So you can see this man. You can see that in which there is a rod kind of structure. Is holding a paper in between. Okay, so you can see that he is trying to hold. So basically, this also was used as a facilitatory technique. So this splint, basically, this patient was 7-month-old hemiplegic. So this splint was designed for him to break his wrist flexion synergy. Okay, so he has that. So what activity we give is he has to basically hold the paper between the rod and his hand. So if he even if he slightly moves his hand to flexion, so the paper will move out. So you can see that even if you make a slightest movement, it will not hold in the position. So which will help him to concentrate. See, this actually had helped him to concentrate better and break his synergy. So there's an interesting story behind this splint also. So as we practiced this method on him, within 2 days, we started seeing change in his synergy patterns. He said, "Sir, I can able to make yogas now. So that much my wrist is cooperating for me when I'm doing yogas. So thank you for your ability." It's the same as the other patient. He is also coming to my department just for this, my ability to look beyond what is written in the book. And also he is like basically he has seen many therapists before. So he's coming for a while, more than 2 months, just for this exciting that is happening in our department. Okay, so based on the mechanical characteristics, the splints are divided into static splints, dynamic splints, and static progressive splints. Okay, so static splint, basically with these type of splint will not have any movable part in that in their property. So you can see here it's a cock-up splint. This is a cock-up splint, thermoplastic cock-up splint. This basically will not have any moving structure in it. So once it is made, it just stays there, whatever angle we fixed. There is a static progressive splint. One of the examples is corrective KF or TS stretching splint. So this belt that you can see, or a strap that you can see, it basically stretches the ankle in whatever degree we can. So for example, if we keep it in, initially we can keep it in 10 degree of dorsiflexion, then we can increase to 12 degree, 30. So it's basically progressive splint. Okay, so also there is an interesting story behind this. So this is not a patient, this is a model at my clinic. Okay, so this splint has traveled to Kazakhstan. That's why I couldn't able to get the model picture. This like the patient's picture wearing the splint, but this yeah, this helps it. Also, this dynamic splint, one such example of dynamic splint where the splint will have some movable component. You can see here dynamic extensor outrigger. You can see loops and there is a rubber bands. So these has a moving part in it. So splints are divided basically majorly in these three types. One is static progressive, and then static, and then dynamic splint. Okay, clear till now? Okay. Then, so this is about the mechanical characteristics. Based on mechanical characteristics and based on purpose, the splints were divided. So slight remind of these chapters. So we have studied that based on the purpose, it has been majorly divided into protective, preventive, corrective, and others. So protective splints are used for immobilizing the structures to promote healing, and then preventive splints are used to prevent contractures, and corrective splints are used to correct the soft tissue, correct the contractures if it would arise. And then there are splints for therapy, splints as a therapy. Also, there is one more type that I forgot to tell you. We can make customized adaptive devices using the splint materials. Like most of the therapists may be knowing that universal cuffs we can customize. Not only that, we can make many customized devices on our own. Once you know the designing how to design the splints, you can design even adaptive devices too. So based on the mechanical characteristics, it has been divided into static, dynamic, and static progressive. Static splints doesn't have any movable part. Static progressive, there will be a movable part progressively. So you can see like this, and there will be dynamic splint where there will be a movable part in the splint. Okay, so there are many principles for splinting. So biomechanical principles are some of the most important principles that you should be considering while making the splint. So this will help you to design and to fabricate splint properly. So I'll be discussing only on that. Okay, so biomechanical principles. Correct biomechanics of splint design results in an optimal fit, reduces risk of skin irritation, pressure area, which ultimately may lead to client's comfort, compliance, and function. So basically, if you can able to include the proper biomechanics in your splint, so it will reduce, like it's a must factor in our type of splints compared to orthotricians and technician. But we are therapists, we're supposed to be carrying the patient, because if there is a wound arises, it will come on us because we are making splint. If we don't care about the patient, the complication that may arise due to splinting, it will result into a very negative view from the patient, because you are the therapist and you are making splint. If you don't consider these factors while designing splint for your patient, it will become quite problematic for you. Okay, so you should make sure that you are following these principles in your splint practice for must. Okay, in addition, knowledgeable manipulation of biomechanics increases the splint efficacy and improves splint durability. So remember, so if you can able to include the biomechanics, you will look entirely different from the technician or orthopedician splint, because for them, as of I know, I have seen biomechanics, they don't uh, consider while they're making splint. They know the how the machine works, but this not all the orthopedician have idea about. So when you consider these things, it will help you a lot. Also, this will improve the splint durability and efficacy that you're planning to give. Okay, some of the biomechanical principles. We'll start with the 3-point pressure system. Okay, so this is something must that you should like. Without this, you cannot even design a splint. That you cannot design a proper splint, because this is when you want whatever purpose, either it is for immobilization or corrective purpose, these factors are must. Okay, so basically 3-point pressure system means there will be a 2 linear force and 1 middle perpendicular force. You can see the phone here. Okay, so basically 2 force. Okay, I'll explain it in the picture. Basically, you can see 3 strap here. Okay, so 2 parallel force will be provided by the structure, aluminum structure. So this aluminum splint. So this point number 1 and point number 2, these 2 points will provide linear force, like parallel force towards the body part, and there is a center strap. It's basically elbow cutter. So it's so the center strap will come over the joint, which will provide at the middle perpendicular force, opposite force. Okay, so with this only we can able to immobilize the structure. Without following this principle, you cannot design a proper immobilization or corrective splint. Okay, so basically in this cock-up also you can see only the wrist strap is it has broader strap compared to the forearm and the palm strap. It's because the more force will come over the center. So this is going to provide the opposite force. This is going to provide the force that is much needed to tolerate the weight of the wrist joint. Okay, so 3-point pressure system is must followed principle while designing the splints. Okay, torque. So if you don't follow this principle, you end up in very like chaotic situation when you don't follow this principle, because using the optimal rotational effect is something which will help you a lot if you follow it goodly. If you don't follow this torque, like how to provide torque, it will end up in the cause. Okay, so you can see this is the flexion outrigger splint. One such example is you can see the part. There is a D-ring which is attached to our one bar type, and there is a holes. See, you don't think that that these are some made just for the purpose of cosmetic glow. Everything has a purpose. So this one is movable. Okay, so this one we used to stretch the severe metacarpal, the MCP tightness. Once there is a severe MCP tightness or extensor tightness, we go for this, like extension tightness, we go for this splint. Okay, basically, if you want to say, it's a stiffness. Yeah. So this splint, if you can see, it provides the optimal rotational force. You can see the force is directly traveling. If you have to basically create a like this parallel force or like a perpendicular force to the joint. If you don't create this straight perpendicular force, it will end up in either compression or distractive force. Okay, so if you, for example, this strap, if you keep it little down, instead of keeping it the straight, if you keep little down, it may create the compression force to the like dorsum area. Okay, which will create the irritation, or sometimes it will create the shear force, which will create inflammation, even skin damages. So you have to be very careful in providing proper torque in your dynamic splint. Basically, even in extensor outrigger splint, these factors are must important. So when you are putting a loop, okay, you have to put perpendicularly. Okay, you have to put perpendicularly. It should not be like this or like this. Should be perpendicularly holding the MCP joints. Okay. Mechanical advantage. Okay, so this is something interesting principles if you follow it. So basically, mechanical advantage means the splint will have the splint, whatever splint you design, it will have proximal force to movement arm and an axis. So it will be comfortable for me to explain out of cock-up splint. See, you can see the splint will have one proximal force. This force provided by the proximal part of the splint, there will be one force. Okay, there will be two movement arms. So this is the axis. Axis will come over the wrist. So like for extending the wrist, the axis is over the wrist joint. There will be axis which will be provided by the wrist bar or wrist cuff over here. There will be a proximal force from the proximal end of the splint, and there will be two movement arms. One is proximal movement arm, distal movement arm. Okay, clear? So there will be a proximal force which will be coming from the splint onwards. There will be two movement arm, one proximal and distal to the axis. Here is the axis of the splint. Okay, so why you have to consider these things while designing splints are, if you don't properly design the splint based on this, if you don't create the proper mechanical advantage in the splint, you may not get the proper comfort for the patient. Okay, so for example, I would like to say, if you don't know this thing, how to create mechanical advantage. Okay, so basically mechanical advantage means whatever the weight. So if you see wrist joint, the wrist joint around it will have 200 grams or 250 grams. So this weight, it will come over the palmar cuff of the metacarpal bar of the cock-up splint. Okay, so this weight will go on the metacarpal bar. Okay, if you don't provide appropriate force, like whatever should be the equal, like if it needs 200 gram of weight, the axis or the perpendicular force which is going over the center part, it should be providing the same amount of it. Also, if you don't provide the appropriate distance, so if the weight of the arm is more, the more you give the like more moment arm, proximal momentum, it will create more comfort for the patient. For example, in this case, if you see, I have extended the proximal moment arm bigger. If I would have made it here, it would have poked the patient because the weight of the weight over here and here doesn't match. Okay, so once you increase the moment arm, it will able to tolerate the weight of the hand. Okay, basically the lever system. I think most of you might be knowing what I'm talking about. The balancing the weight just by increasing the distance. When you are giving therapy, you'll be knowing what I'm trying to say. Okay, so if you increase the distance, it can able to tolerate the weight of the hand. Okay, if you don't understand, I like to give an example. I don't know, like the old, that weighing machine. Mostly in villages, people you might be seeing, or you can Google it. You might be getting it. So okay, there will be a stick in old age system. There will be a stick, and okay, so and there will be 3 cuts in the stick. Okay, the person who is weighing will not have any weights to weigh the vegetables. Basically, vegetable selling people usually will have that kind of weighing machines in the past, in the history. Okay, so basically they will have 3 cuts. If you see, if you ask them like put a 1/4 kg of vegetable, they will not put any weights. They'll just change the distance of the thread, and which will, okay, so and it will be appropriate when you weigh it in the weighing machine. Okay, so just by increasing the distance, you can manipulate the weight. So similarly, if you just change the distance from the axis, it can able to tolerate the weight of the distal, the force, the resistant force that is given by the weight of the hand in the distal part. Okay, that you should be knowing. So few ways to increase the momentum, as I told, mechanical advantage is to increase the momentum, and second one is increasing the circumference, making the nice, giving a nice like a throw over the forearm, like a nice giving good circumference. At least half of the circumference of the part should be included. If you don't give the proper rounding, okay, of the splint, it may not give the proper mechanical advantage. These factors will help you to provide the appropriate mechanical advantages in the splint. And then the factors that you should consider when you're planning splints, the most important factor that you should be considering when you're making splints were stress and pressure. Okay, there are 4 ways in which skin and soft tissue can be damaged by force and pressure. Yeah, so what not to do, that you should be knowing when you're fabricating or designing splint. So these are some of the things that you should consider to not to affect your patient or to increase the comfort of the patient. One is degree and duration of pressure, repetition of stress, and direction of stress or pressure. Okay, we'll read it in detail now. Okay, degree and duration of stress. Generally, the patient, whatever the splint we are designing, we have to give it low stress for longer period of time rather than high stress for shorter period of time. Example, so rather giving the extreme stretch in 10 minutes, you can give mild stretch for 2 hours, which will benefit the patient more than giving high degree of stress in the short period of time. If you give high degree of stress for longer period of time, it will cause skin damage and further damage to the patient, especially if the patient is injured and coming to you, the patient's structures, the soft tissue structures are already weak, they are flare. So even if you get slightly higher degree of stress, it will end up in skin damage, which will affect your patient and you. So you should consider giving just low level of stress for longer period of time, and which is the best method to do it. Okay, even if the low stress is given continuously, for say you are giving continuously for like you wear this splint whole day, like 16 hours, 18 hours, this will also lead up to capillary damages. So try to avoid these things when you are teaching the patient for donning and doffing. So ask them to provide just low, like especially in corrective splint, you have to provide just little amount of stretch, the tolerable stretch for longer period of time, than giving higher degree of stress in the short period of time or longer period of time. Okay. Then repetitive stress. So usually it happens in the dynamic splints. If you provide stresses to the joint repeatedly for multiple times, like for example, in case of extensor outrigger, if you ask the patient to wear and continuously ask them to flex, extend using the splint, it will end up in skin breakdown too. Okay, even there are possibility it may create inflammations too. So try to avoid this repetitive stress in that, especially in the dynamic splints, so that the tissue damages can be avoided. Fine. So it may lead to inflammation and tissue breakdown, as it is said. Okay. Direction of stress. This is something very important when you're making a splint, because if you doesn't consider which direction the stress is going to be, the purpose of the splint, if you don't consider, it will end up in chaos. There are three direction of forces. One is tension force, compression force, and shear force. Okay, so tension force, basically it will distract the joint. Compression, basically it will compress the joint. Shear force, basically it will shear over the skin. The shear force is very uh, negative, and it will damage the skin structures, especially in the acute area. Okay, even the other forces also, if it is not given at the right amount, it will lead to the problems. Okay, so therapists should have the knowledge of using this process while designing the splint, especially when you are planning to make early mobilization splints or preventive splint. You should consider what type of force the splint is providing. Is there any shear force? Is there any structure which is shearing over the joint? For example, if you see here, it's a Metanan splint.
Put on this straps. Start with this.
If you see this Metanan splint, okay, this also is not a patient, it is the model. So the splint was traveling to Bangalore, so I didn't get the patient to do this. So this is on the model. If you see, there is a mitten that is being put on the hand. Okay, so if this mitten creates a shearing force, when you are giving the splint, this will create the inflammation or tissue damage over the skin. Okay, so this I have created just to give compression force in the joint. If I don't know what kind of force I'm generating, so I may end up in giving the wrong splint. So this was given to create the compression force as well as tension force in the extrinsic region, or the extensor region. Okay, so this are also the splint that is nearby. This one is a anti-enema strap. This was given to create a compression force in the joint. Even if this splint create the more compression, it may end up in capillary damage and the reduced blood flow to the distal part, which may end up in future more problems to the affected part. So should be sorry, knowing the right amount of stress to the joint or the body parts. Okay, thank you for listening to me. Okay, so this is my number. If anyone wish to contact me, you can take this number, or discuss in person, can use this number. Also, I hope this today's topic will help you a lot when you are planning to make splints. Okay, also this is something important when you are designing splints in this workshop. Okay, let me revise it once. Biomechanical principle that you should consider while making splints were 3-point pressure system. As I told, the 3-point pressure system means there will be 2 linear force or parallel force will go over the proximal and distal end of the splint, and there will be 1 perpendicular force from the strap opposite side in this splint. Okay, so basically these this system, these forces are something important when you're planning to immobilization or corrective splint. So in immobilization, the center strap will block the movement. In corrective motion, if it goes to corrective purpose, the center strap will give the appropriate force for providing the stretching. Okay, so this one, then the torque, it should consider providing the optimal torque, optimal rotational force. It should be exactly perpendicular. Remember, it should be straight perpendicular to the perpendicular force should be provided when you're planning to give this splint. When you don't provide perpendicular force, when it is creating When it is not perpendicular, it may create compression or shear force over the skin area. So you should be considering providing optimal rotational effect on the splint. Also, why these holes were made is to adjust as the fingers moves down. This will be adjusted to the lower level so that it accommodates. Okay, I forgot to mention that point. Okay, so mechanical advantage, consider providing maximal mechanical advantage to the splint so that it doesn't create any discomfort or the shear force or compression force to the joint. Try to give the increased moment arm over the proximal to the axis. Also try to increase the circumference when you are providing more force to the splint. Okay, the more the force, try considering providing the more circumference and increase the movement arm. Stress and pressure, there are 4 ways in which the skin or soft tissue can be damaged. One is degree and duration of stress and pressure, repetition of stress and direction of stress. Okay, degree and duration of stress, generally the low stress for longer period of time is best. High stress for long period of time is very, very bad, and low stress for continuous wearing is also bad. Try considering only low stress for optimal period of time. Optimal period of time changes for patient to patient. Optimally, try considering how much the patient can tolerate the stress for how much time. Consider that factors before giving splint or while teaching the donning and doffing to the patient. Okay, repetitive stress. Try to avoid the repetitive stress in dynamic splint. Repeatedly providing over the skin area, it may lead to inflammation or tissue breakdowns over the affected parts. Okay, direction of stress. Consider which direction of force or which direction of stress you are planning to give. Okay, so avoid shear force over the joint, which will create inflammation over the skin. Try to give maximally the tension force or compression force, whatever you are planning to give. If you're planning to give compression force, give it in an optimal way. It should not be more compression phase, which may create the damage. Same applies to the tension force. If the tension force also more, it may create the tissue damage. See the optimal level of tension or compression force you are trying to give in the splint. Avoid shearing force to the maximum. Thank you.